Well, I think that worked. I'm not really sure, but I was trying to be slick there. So, hopefully we will get started here in just a few minutes. It is 5:54, so we'll get started in 6 minutes. I think I've been pretty timely so far. So, let me know if you make it on here. I guess I need to figure out where my chat box is so I can monitor that kind of good stuff. No, I don't want to create another event. I want to see my chat box. Well, if you wander on here, say hi so I can actually find it, because every single time I cannot find my chat box. Comments? Is that it? Nope, that's not it. So hopefully somebody will wander in here and say howdy do and tell me where you're from, and then I can figure out how to answer questions in real time, and we will get started here in just a moment. So bear with us. If you don't know, I'm Bob Linde from the Trigeminal School of Herbal Studies in sunny St. Petersburg, Florida. And we are doing this both online and in person now. Yay, I got people on here. Somebody say hi so I can figure out where the heck the chat is. And presumably I'll find it here in a few minutes. And besides just saying hi and give me a thumbs up, please do if you have any additional questions. I've got a few here that people sent in, and I will put those in the queue, if you will. Post detailed. No, that's not it. All right, that's alerts. That's not what I want. Well, that's all right. I've got 3 minutes to figure out where in the heck the chat is. That's a poll. Let's try that. No, I was sure that was it. That doesn't seem to be it at all. No, I want to be able to comment. So I see there's a few live bodies on here, so do feel free to say hi. Let me know where you're from. Oh, wait, I see 6 comments. Now I just got to find them. That's so bad. I see that you all said something. Maybe that. Polls, questions, graphics, distribution. No, that's not it. That's not it. Well, that's not going to be helpful if I can't find it. They seem to have changed the format on here, since it was a whole new adventure trying to get on here. Let's expand the video so I can see me. That says comments. That just seems like where it should be. Well, I appreciate you all saying something. Now, if I could read it, it would be really freaking amazing. And there's 10 of you on here, and I have 7 comments. I have no idea. Oh, that is so absolutely ridiculous. All right. It's not under there. No, that would be too easy. Alert sounds, remove module. I don't want that. Open in a new tab. No, I don't think I want that. I just want to see it. Well, hopefully in the next 2 minutes I will find this. This is so ridiculous. I go through this every single time, much to my trauma. And every single time, usually at some point, I do find it. So thank you for bearing with me. I have 2 minutes to find it. No pressure at all. Ooh, maybe it's that. I see, I got a dashboard. No, that's not it. That's not there. No, that's super frustrating. We're already doing that. No. Whoops, hopefully I didn't screw anything up. Ooh, there we go. No, that's not what I want. Hopefully everybody can still see me. Sure, I don't care. I don't care about that. Sure. All right, we'll see what happens with that. For some reason, I don't think I wanted that, but that's okay. And all right, that was magical. Oh, look at that. I found comments. I have no idea once again. But hey, Babsy. Cat. Long time no see. Oh, it's old homework here. I got John and Cat. Hey, Linda. I got everybody on here. Awesome sauce. Well, we got a nice crowd here. Look at that. Perfect timing. Right at 6 o'clock once again. So, if you don't already know, I have no idea how many people are on here, but it looks like we got a nice crowd tonight, and I got a couple of good questions in the queue, but feel free to type some more. And I will say that I am running this one solo, so if I miss something or I don't acknowledge it in some crazy way, please don't hesitate to type it in a second time. You will not be bugging me. And if you don't know, I'm Bob Linde from the Tradition School of Herbal Study in sunny St. Petersburg, Florida. And this is our open forum that I started doing in the last Friday of every month. Started because of the pandemic and was missing interacting with everybody. And so I got such a good turnout on this, I was like, what the heck, let's just keep doing it even though I get to see everybody now. So it seems like we reach out to some old graduates and old friends and new friends and all of that. So I'm going to keep doing this until I get tired of it, which I'm sure will happen at some point. And if you've never been here before, I apologize in advance because I kind of just go stream of consciousness and download way too much freaking information. And if you don't know it, oh, look at that, I can't see myself, so I don't know if I'm showing you stuff. There we go. I'm going to do that shortly. If you don't know it, Herb Day is coming up. It's not tomorrow, but it's next week. It's the first Saturday in May every year, and for reals, it is. I still call it National Herb Day. I saw somebody was posting International Herb Day, so I think by next year it should be Galactic Herb Day or some foolishness like that. But I'm going to claim with no justification whatsoever that we have the largest, best attended Herb Day in the world, at least in my sphere of the world. But we've got over 25 vendors this year, all herb related. We throw them out if they don't have primarily herb-related stuff. A lot of our students and graduates are vending. We've got 2 lecture tents going for the entire day from 10 to 4. We have the elder tent for the professionals, and we have the Biden's tent for our senior students, having their presentations and also having a product table where they're able to present the world with their new products to see what kind of a response they get, and hopefully to make a buck to pay for all my classes. Let me get, because that's an important one, Kat. I'm going to do that. Chinese Vitex. All right, I got to write that one down. So I hope that you all attend. We usually get like 500 to 1,000 folks. We take over to the entire block. We're on all the corners. Most important for those of you who are able to make it, make sure you go in back. That's where all the really cool vendors are. There'll be probably 5 or 6 vendors. The music will be back there. And I think the back of the clinic is super beautiful. If you don't know it, we have all kinds of interesting classes as well. We have a Thursday lecture series, and sometimes it's in the evening, sometimes it's not, but usually in the evening. We have an Ayurvedic lecture series that's taught by Gray, and we have a class on that coming up next Thursday on the endocrine system and how Ayurvedic medicine looks at that. And she'll do about a half a dozen herbs and talk about all the coolness of some of those herbs, some that grow wild here in St. Pete or in Florida in general, and some that are a little bit more obscure. And we've got Tricia teaching the anatomy for the herbalist. For those of you who it's been a long time since you learned any cool medical-y stuff, she does a really nice review of systems that's linked up with both our Ayurvedic series as well as our Western Herb Foundations class. So on the 12th, she's doing the endocrine system for the herbalist, anatomy and physiology. And Ruthie, one of our other instructors here and also clinical supervisor with me, is doing a class that I'm super jealous of. She created a medicine-making circle where she spends 2 to 2.5 hours talking about a single herb, everything from its history, propagation, harvesting, medicinal use, and then different ways to make medicine out of it. So coming up on the 26th of May is rosemary, one that I'll be talking about a lot this weekend as well. And I'm teaching a free class. I do this one at least once a year, sometimes more, on, I just noticed that, Friday the 13th, May 13th. I'm doing an herb drug interaction class here at the classroom from 6 to 8. Please do register. I'll have that online as well as in person. And I would say it is a very practical guide. And I'm missing one of my pieces of paper. There it is. Very practical guide. So anybody from practitioner who needs a refresher or lives in fear of giving any herbs or supplements while somebody is on prescription meds, and also for the general public so that you can be safe when you're out doing your homework if you happen to be on medications. So I keep it simple, a little Western, a little Chinese, a little pharmacology, all tossed into 2 hours, and I'll not only talk about negative herb-drug interactions, but also positive herb-drug interactions. And this one's a new one for me. Oops, I got to cheat and see. Nope, there, got that. Let's see. There we go. This is one I'm going to be lecturing at in Durango, Colorado, the Good Medicine Confluence. It is July 28th through the 31st. I've heard nothing but great things about this conference, and if nothing else, I'm excited to be going to Colorado. So if you're able to join me there, you can either get tickets from them online. It does sell out usually, or you can get them from me as soon as I figure out how I'm supposed to do that. That's on my list of things to do after Herb Day. We're a little busy till then. So I'm going to get right at it. Man, where do I start? So many choices. I won't say I have enough. I always end up having enough. All right. You know what? I'm going to start with yours, Kat, about the Chinese Vitex, just because that's a short but sweet one. So there's a lot of confusion, especially in the older Bensky books. So Vitex is a very commonly used Western herb that is used for gynecological issues for women primarily. It is used to regulate, normalize, and even raise the progesterone levels, and oftentimes is used intermittently through a woman's cycle. And if you get it right, it's magical. Sometimes it'll screw things up if you don't quite get it right. But the Chinese manjingzi, let me make sure I spell that right, manjingzi, I believe I'm spelling that. It might be a G on the man there. But that one in the textbooks, at least the older ones, it is listed as Vitex with the same genus and species as the American. I am here to tell you it's not. And it'll be interesting. Feel free to email me a picture later, Kat. But the Chinese one has an ovate leaf actually, and a larger fruit. The seed is larger, and we use it for completely different stuff. It's actually very rarely used, and we don't see any of the gynecological benefits that we see from the American one. So it's one of those where fun to grow just to do a shop and compare, and it gets confusing without a doubt. because we have, I'm sure there's more than three, but three that I find regularly. The one that is European / American, it's naturalized here in America now, but it was originally known as monk's pepper, and so it was used in Europe to try to help the monks calm down. It didn't work. And we have a beach Vitex that is native here to Florida, grows coastally. I've not worked with that one, and I'm here to tell you the smell and the flower to me is not correct. I actually love the smell of Vitex, the American / European. I think it's a wonderful smell, kind of looks like a pot leaf. I've almost been arrested once for Vitex. But the beach Vitex has a very acrid, musty kind of smell to it. When I eat it, it does not taste right. So although it may have some of the uses of the herb of commerce, I don't use the beach Vitex. It's too easy to get the true Vitex. So really go, and I know you've got some experience with Vitex, Kat. And I'm going to say this is important anytime we're working with an herb we're less familiar with, or a new species of herb. And sometimes we can find same genus, different species, local species or something, regional variant that has exactly the same uses, maybe better uses. Things like willow. Most of our willows have similar uses with varying amounts of marker compounds like the salicylic acid, and we can use them pretty much interchangeably for medicine. But others, not so much. And so it's important that you do your homework and see if it's the same species the local indigenous people used, and see if it matches up somewhat. But also trust your taste. That organoleptic testing, when we look at it, we smell it, we taste it, and it doesn't have to be the same, but it should be similar in its flavor and smell palette. That is an indication of many of the constituents that are in there. And so if it's dramatically off what you know of for the herb of commerce, then you may not want to try to use it interchangeably, or just need to do some more homework. So you should be able to look up the manjingzi and learn all kinds of good things about it. But know that it is not the same as our American Vitex. Hopefully that helps you and get you off in the right direction. All right, where shall we go? So, I like it when people feed me my favorite rants. Makes my life really easy, because I could literally, that one wasn't a big ranty one, but I'm going to say, let's do another short one. I was asked about a Chinese betony, Stachys affinis. I believe came from China, was exported to France, and then from France was moved into the Northeast, and it's been grown in all of those. For all practical purposes, it looks exactly like our Florida betony, our rattlesnake root. So the one I'm talking about, though, is Stachys affinis, and that is, I'm not sure what all of its common names are. It's got a couple of common names, and ours here is Stachys floridontum, and basically Stachys florida. And the Stachys affinis is the one that we oftentimes refer to as this culinary $150 a pound in the finer French and New York City restaurants. I have not had the pleasure of snacking on one of those roots, but all the accounts I've read, we could probably have a black market rattlesnake root and run that up there. And, I personally would be more than happy to dig up a couple of pounds and sell them for $75 or $100 a pound for a restaurant if they want to. What it appeared is that the affinis was larger and thicker than the Florida betony. Although that may have just been the cultivated ones that I was looking at. I'm going to say that Many of the betonies, many of the stacus, yeah, I wouldn't pay $150 either. I'll sell it for that. Many of the stacuses are used for the same purposes. So when we look at the European wood betony, which you can also grow here, it was a herb that was being used as a nervine adaptogen, and is the old ancient medieval saying of sell your coat and buy betony. I would say our Florida betony is interchangeable with that. Lots of arguments of which one's better, stronger, whatever. I think that's almost depends on how well you match the herb up with the person. I tend to look at nervous dysfunction, dystonia, where the frazzled nerve kind of idea. I particularly like the aerial parts of the Florida betony for that, or the wood betony. And for someone who's ungrounded and needs more moistening nourishment, I can use the roots, but they tend to be slower and more gentle. So the aerial parts are the better medicine out of the two. All right, those were the easy ones. So there was a question about acid reflux, and there was a very specific type of acid reflux, and I am going to group them all together because for all practical purposes they're all treated the same way by the medical industry. And I would say for me as an herbalist, and not to say I'm a functional medicine doc, but I do practice, I dabble in my functional medicine, and as much as I like energetics, I love energetics, I would say whichever diagnostic system is the most important, or the most effective to getting to the root cause, that's the system of diagnosis we should use. So I tend to gravitate either to Western or Chinese energetics, but I also love blood work. I love imaging. I think Western medicine has the ability to spot stuff that we might not see. If somebody has acid reflux, I am challenged without an awful lot of question and maybe a little poking around. How do I differentiate high stomach acid from low stomach acid from a hiatal hernia? And so sometimes Western medicine can speed that process up and let us know, if there's a more serious problem going on. And I'm going to say, whereas Western medicine tends to define their acid reflux based on where the inflammation shows up, or they look at one structural issue, which is the hiatal hernia. The oddball thing is they don't differentiate between high and low stomach acid, even though repeated research in many different places show that half the acid reflux is caused by low stomach acid. The treatment, of course, is the same whether you have a structural issue, hiatal hernia, and I'll explain all those here in a second, excessive acid, or low stomach acid. They give what's called PPIs, which are proton pump inhibitors, or H2 blockers, which are histamine blockers, basically acid reducers. So if you have a structural issue, hiatal hernia, they reduce your stomach acid, which makes no sense to me. If you have low stomach acid, they make it worse by lowering your stomach acid more, which of course makes no sense. The one variation that they found, and I actually encourage it, if you have ulcers, they found that most ulcers are caused by an overgrowth of H. pylori, a very specific type of bacteria that we all have. So that is a naturally occurring bacteria in us. And when it becomes an overgrowth, it causes ulcers. And so the correct treatment for that probably is antibiotics. Not to say we can't do it herbally, but if you have a bleeding ulcer or one that's that severe or multiple locations, the safest answer might be to go ahead and correct that quickly with antibiotics. It's usually like a 2-week course of antibiotics for that. And usually effective in correcting the ulcers and the overgrowth of H. pylori. And the problem is it doesn't say why'd you end up with an overgrowth of H. pylori. So let me start with the hiatal hernia because that's the easiest one. And hiatal hernia is, and there's variations within the realm, but I got to move the camera, so I'm not going to see anything for a few minutes here. Hopefully you guys can see it. So this is your diaphragm, this dome-shaped muscle that's right here on top of your belly at the base of your ribs. And that diaphragm is your muscle of respiration. When you inhale, it goes down. When you exhale, it goes up. But through this diaphragm, this muscle, is a bunch of tubes, right? So we have blood supplies and things like that, but in particular, your esophagus and your stomach. So if this hand is your stomach and you're overweight, lifting heavy things, bend over in your work a lot, what happens is your stomach starts to protrude up through your diaphragm, and that causes acid reflux. So the treatment for that should be to pull your stomach down and not reduce your stomach acid. So that is something that is usually ascertained through imaging or an endoscope. They can sometimes tell it from that. Sometimes you can just palpate and find that it's protruding up there. For women, if they've ever been pregnant, chances are you have a hiatal hernia. Folks who are overweight or obese oftentimes will have that issue. Or folks who lift heavy weights, especially while bent over, and that can be either working out at the gym or a job, like lifting cinder blocks or something if you're in construction, or working on cars where you're at weird angles, leaning against your stomach while turning a wrench. Those kinds of things can cause a hiatal hernia fairly easily. Probably the folks who have the best success with the hiatal hernia are chiropractors. They're actually trained on how to pull the stomach down, and it usually takes a number of treatments to do that, and at some point it will stay in place, hopefully. But there's also, I always say, ask your chiropractor to show you how to do it. Let's see if I can do it. So bottom of my ribs comes up to a xiphoid process. Here's my breastbone, and then there's a little knobby, tender thing that hangs down from that. Take your thumbs, stick it right there in your xiphoid process, and go bloop, and pull down. Boop, really gently. It's easiest done when you're laying on your back with your knees bent. Oh wait, I forgot to say that. Nothing I say should constitute medical advice, and none of you are my patient unless you are. And so check with your doctor, herbalist, acupuncturist, chiropractor, or whatever Yahoo is appropriate for you to find out which one of these crazy things I talk about is appropriate for you. And I have no idea why I'm saying that, but I started saying that last month. So now I feel less guilty and I live less in fear. So don't do anything I tell you. I do recommend that you learn more about all of these things. There's so much information online about how to help with a hiatal hernia. YouTube's got tons of videos. I need to make one and put it up on our YouTube page, which for anybody who gets bored and doesn't want to watch the rest of this live and in person, you can catch the rest of it on our YouTube channel, which is, if you go to YouTube and check for Tradition School of Herbal Studies. There we go. Stop abbreviating. So it is challenging to ascertain a hiatal hernia without just palpating, and usually you can feel it. Usually if you match some of those criteria I said, there's a good chance of it, and the MDs can do imaging from that. There you go. I'm sure you can find a chiropractor up there. So the least common one that I found is excess stomach acid. And the email that she sent mentioned that staying away from trigger foods, alcohol is oftentimes a trigger food, tomatoes, acidic foods, and oddly enough, a lot of those trigger foods are often foods that are probably not our friend and are hard to digest. And so there's a couple things that we should always look at when somebody's complaining of acid reflux, and they were like, I always say it's like, are there trigger foods? And they're like, yeah, if as long as I don't eat this, this, or this. And sometimes those things can lead us down a pathway of understanding a larger picture that's beyond just acid reflux. And tomatoes are one of the famous ones. And there's two ways to interpret why a tomato, we always say, oh, it's acidic. Well, it's like, yeah, but does orange juice cause that problem? Do 1,000 other things cause that problem? Or is it just tomatoes? So tomatoes are not actually a vegetable. Tomatoes are a fruit and are very high in sugar. And so sometimes we find that the sugar in there is an aggravator, and that'll make more sense because I'm going to end up talking about Sibo here in a minute. Or tomatoes are in the nightshade family. And nightshades I'm finding a growing number of people who are sensitive to nightshades. And so our nightshades, our Solanaceae family, are your tomatoes, potatoes, eggplants, any kind of pepper. So jalapenos, green peppers, red peppers, you name it. If it's a type of pepper, it is got nightshades in there. And ashwagandha. And so if you find that some of those foods I just named are also your trigger foods, you probably have a sensitivity to nightshades, and you're getting more than acid reflux. You're probably also getting some generalized inflammation that's causing some other problems. And it's funny, if the tomatoes only occasionally cause a problem, or the potatoes only occasionally cause a problem, I'm gonna, for those of you who are on here every month, you're gonna hear a lot of things get repeated. So one of the things I always say is like, what'd your grandmama do? And whatever she did was probably right. And it's funny, peppers, a lot of those peppers come from Mexico, Central South America. We look at equatorial warm countries. So classically in the Americas, you would grill your peppers and peel them. And there's more of a, hey, Gray, oh, thank you. Yes, I forgot about nicotine. Good call. So for tobacco smokers where you're like, I don't know how people do this, or people get really bad reactions, tobacco is a nightshade. I always forget that one. That one's new to my list. So the higher amounts of the chemical in the Solanacea's foods is usually in the skins. So classically in the Americas, they would grill and peel the skins. The same with the tomatoes, that they were dipped in hot water, you'd pull the skin off, and then you would go ahead and make your sauces or salsa or whatever. In Germany, we always think of, German potato salad and all that. They laugh at us for leaving the skins on. And back in the day, I remember it was like, no, you got to leave the skin on. That's where all the nutrients are. That's also where all of the chemicals are that cause inflammation in those people who are sensitive to nightshades. So go back and do what your grandmama did. It was not until the 70s that we thought potato skins were good for us. So it's a very new animal. And the tobacco is never good for us, right? So looking for those trigger foods to see if they fall into a category that may be unique to him. And then let's talk about, sorry, I'm looking at my notes here because I didn't have a printer handy. Low stomach acid, let's talk about what that looks like a little bit. So if you have high stomach acid, you're going to get acid reflux when your stomach's empty, because there's an excess amount of acid churning away in there and causing a problem. And for most people, they get acid reflux with the foods they eat. And so eating food would dilute your stomach acid to the point where it's not an issue. And so if you're constantly eating to keep your acid reflux away, you probably have you probably have high stomach acid. If you only get acid reflux when you put food in your stomach, chances are very good that it's low stomach acid. And there are many reasons for our stomach acid to be low. A deficiency in B12 is very common, so we see a lot of for folks who eat a vegan diet that are not supplementing with B12, We find that after 3 to 5 years, we see an increase in acid reflux, bloating, difficulty eating, and then even if they wanted to start eating, more animal proteins, they can't because they don't have stomach acid to break it down. And so supplementing with B12 or looking and doing blood work to see if there's a B12 deficiency, since that's necessary. It's a catch-22. You need B12 in order to make stomach acid, and you need stomach acid in order to absorb B12. So sometimes we have to get fancy with that and even do injections and things like that. Aging can have a role in our stomach acid. And it's funny, as we age, we see a number of hormones decline. And so estrogen, testosterone, collagen, there's all these things that decline as we age. We get wrinkles, stuff doesn't work, blah, blah, blah. And so magically, Western medicine believes that the only secretion in our body that actually gets excessive is our stomach, and that's why it must be sedated. So the reality is, generally, as we age, we get less and less stomach acid. We see a lot of the elderly have decreasing appetite, so they eat less and less because it's harder to digest. They eat a little bit simpler. We see softer foods. We see less protein, less red meats, because those are harder and harder to digest as they get older. You know, we were all had those cast iron stomachs when we were 20-something, and somehow it seems to go away. Yeah, John, I totally see the spleen, technically stomach chi, but I would say spleen chi deficiency has a direct connection to low stomach acid. In the same way we see stomach fire has the excess stomach acid. The other thing, and it's funny, I did a 3-hour lecture on this at the acupuncture conference last year, and it was well received and somewhat shocking. Long-term stress shuts down our stomach acid. And I know when you wrote this question, there was there was so many warning signs for low stomach acid it wasn't even funny. And I'm notorious for this, the not chewing, rushing to eat your food. One of the ancient Chinese sayings, if you will, the stomach has no teeth. And so our digestive process, we would say actually starts in the pan, and I'm going to back that one up. But also starts, our first digestive juices are chewing, that we break the food down, we masticate, and we mix it with some of the enzymes that are in our saliva to help break that down. But there's a couple of different phases of digestion. And the first stage of digestion is called the cephalic stage of digestion, and I think you can Google that, one would hope, cephalic stage of, So the cephalic stage, basically meaning your head, your brain, is that act of cooking our food. The slow food movement is very correct, that our brain registers the smells, sights, and sounds that are part of the experience of food. And think Thanksgiving dinner, holiday dinners of your choice, and the anticipation of all of the smells that fill the kitchen in preparation for the big family and friends meal on the holidays, and the gnawing hunger that's in your stomach as you're like, I can't wait to taste whatever your favorite food is there. And we all remember Pavlov's dogs. They hear the bell. They were programmed to hear the bell, and they would start salivating. And so that was literally the cephalic stage of digestion. So 20% of our digestive fluids start in the cephalic phase. So if we're microwaving, we're getting Uber Eats, we're eating at somebody comes by with the sandwich and we grab it off the sandwich cart at work and we just stuff it in our pie hole, then you're losing out on 20% of your digestive juices that are necessary for breaking down your food. And I am notorious for this, so I am the worst offender of everything I'm saying. And if we start to make a habit of that, then in the same way Pavlov's dogs learned to salivate at the sound of the bell, we actually learn not to produce the digestive juices because our body just gets used to it. The other thing is, as we said, stress. So stress is unfortunately a monkey wrench that we throw into our digestive system. And if we think about it, we talk about that fight or flight response. And if you're being chased by a rabid wombat, everybody else says you saber-toothed tiger, and I got tired of saying that. And you've got to decide whether to fight this frothy-mouthed wombat or run away. The least important thing is whether or not you can digest your turkey sandwich. And so literally your digestive juices, to include your stomach acid, your hydrochloric acid, are shut down from that. And your peristalsis, the contractions of your small intestine that move all of that chyme, the food through your digestive system, all of that stops because it's completely unimportant while you're going through that fight or flight process. And so for people who are under long-term stress, that they're constantly being attacked by rabid wombats, and have stressful meal times, and not taking the time to cook meals and to appreciate that process, literally their stomach acid is no longer being produced. And so it's important, and everybody can research this one after we're done with all of this babblement. The part that we never talk about is if we have fight or flight, what's the opposite of that? And that's the rest and relax. And so that is controlled through the vagus nerve, and the ability to do that is dependent on the strength of your vagus nerve to counteract that fight or flight. And so we talk about the vagal tone as the way that we handle our stress. And so there are many things: belly breathing, meditation, humming, singing, chanting. All of those can have a role in that process. And so working on creating as low stress of a process as possible as you go into the meal. That's not when you should be confronting people about what did you do at school today, telling your kids that. That's the time of either quiet or pleasantries, or positive things, exciting things that are going to improve digestion in that process. And I'll add to that, I think you mentioned you were doing digestive bitters, and it sounded like, and digestive bitters are phenomenal and absolutely nothing wrong with those. But when you don't get success from digestive bitters, sometimes that actually is telling us it is a stomach acid, a hydrochloric acid issue. Because the digestive bitters do their best work for the bile secretions, your gallbladder. That bitter starts that gallbladder to warm up, for your liver to produce more bile, for your gallbladder to start to excrete some of that to help break down fats. But for breaking down proteins or for sterilizing our food, we need hydrochloric acid. So many of your digestive enzymes do not contain hydrochloric acid, and the best test to see whether it is low hydrochloric acid is take some hydrochloric acid with some food. If you've got some food in your belly and you pop a hydrochloric acid and you're like, oh my God, what the heck, I'm burning my face off, you don't have low stomach acid. If you notice absolutely nothing, chances are you're low in stomach acid. And what happens is, long term, if you have low stomach acid over a long period of time, and that varies from person to person as to how long that might be, it could be months to years, but an issue comes up called Sibo, small intestinal bowel overgrowth. I hear bacterial overgrowth, but I don't think that's correct because it can be yeast or bacteria, and they do have a fairly easy medical test that they can determine it, and they look at which is more predominant, the bacteria or yeast, and then they either use an antifungal or antibiotics, usually both. I usually encourage to do both. Sibo is a pain. If you have Sibo, You have all kinds of fun bloating, nausea, vomiting. Probiotics will make SIBO worse. So if you take probiotics and you're like, oh, I'm never doing that again, it made me feel horrid, that is almost an indicator that you have that issue. Sugar tends to feed the SIBO, and so it's funny. Guido Masse, who is the owner of Urban Moonshine, now works for Traditional Medicinals. Really, really smart herbalist, good teacher. And he gave a class on SIBO a number of years ago. And he basically used a lot of killy herbs, eliminate sugar and refined carbohydrates, always a good idea. But he found that it was so hard because there is a living entity inside of people that kind of takes possession of them and makes you, it causes the cravings for sugar and carbohydrates, that it causes mental health issues. And he actually encouraged people to do things like mushrooms and other psychoactive herbs as a way to regain control over their mind and body and their nervous system, because SIBO is literally a type of possession. Where it's forcing you to make bad food choices, which sounds ridiculous. But I've seen it time and time again that people really struggle with trying to stay away from those things that literally makes them ill. So you can ask a GI doc or a functional medicine doc that if they'll order a Sibo test. It's basically you drink some sugar water, and every certain number of minutes you blow into a bag, and they measure the amount of carbon dioxide and the amount of hydrogen. And that determines how bad your overgrowth is. The other thing I forgot to mention that is an increasing problem is this idea of alkalized diet. In an alkalized diet, if that means eating your vegetables, then I'd say that's awesome. We really should be eating vegetables should be the biggest part of our plate. Some complex carbohydrates, eating a variety of different colors of vegetables and starches, and a variety of proteins. And so I would say both plant and not plant-based proteins are good. That they all have different things. They're more than just B12 and amino acids. They have a variety of non-essential kinds of things there that each one acts differently in the body, both physically and energetically. And so what some people are doing that is causing, it's bad science that's throwing a monkey wrench in, is they're either doing alkalized water, and so they're doing pH water that raises the pH, i.e. alkalizing it, which when drank will reduce your stomach acid to the point where you're no longer able to break down your foods. It potentiates SIBO as well as other inappropriate bacteria and yeast growths throughout the bowels. Or they're taking pills that are alkalizing pills, most of which are made up primarily of sodium bicarb, what most of us know as baking soda. And so that's a very quick way to alkalize your stomach and cause major digestive issues, especially long term. I'll add to that, I'm not a fan of using the acid reflux medications, the PPIs and H2 blockers, and for that matter, Tums. If you do that because you drank too much, ate too much on holiday evening, no big deal, no harm, no foul. But when doctors prescribe those medications to you, they usually do it for life. Even though if you read the box, the insert on that, it says to consult your doctor if you continue to have symptoms after 4 to 6 weeks. There is zero research on those medications past 1 year. And it's basic science that if you reduce your stomach acid, which is the aim of these medications, you're guaranteed to diminish the amount of B12 you're able to absorb. You're guaranteed to not be absorbing your minerals appropriately. And the minerals are vital for our nervous system function, our heart rhythm function, our ability to sleep, to metabolize things. And B12 is a vital substance in every single cycle that goes on in our body, everything from detoxification to it is the main engine for the mitochondria, the powerhouse for every cell in our body. So if you're like, yeah, well, I really do have high stomach acid, I have to do the acid reflux meds, you need to supplement with a methylated B12 or consider doing injectable B12. I actually prefer doing B complex, but sometimes people would just do the B12. Monitoring those numbers through blood work, that's a very basic normal test, and a mineral that is chelated, so a multi-mineral that's chelated, which basically means they throw a citric acid molecule on there, which makes it easier for your body to process it, because it throws that acid that you need right onto the mineral molecule. But ultimately, I would say correcting why you have actual high stomach acid because of its rarity should be investigated. If there's a structural issue, hiatal hernia, then without a doubt you should get that structural malady corrected. It's fairly easy to do, unless of course you keep re-injuring it, in which case it's a little bit more work and makes the chiropractors very happy. If you have low stomach acid, it's very easy for your high protein meals to get a supplement of hydrochloric acid. There's a lot of resources online about dosing and timing and so forth. I tend to go slow and steady, but I know people who are doing fairly large amounts, they'll take it to acid tolerance, i.e. they'll take it with their protein-rich meals until they get acid reflux and then back down one pill. It does have to be done with a pill because it's hydrochloric acid. You don't want that hitting your throat. That hurts. So it's usually a pill that will travel into the stomach and protect it there. Apple cider vinegar is okay, but what most people do is they put the apple cider vinegar in water, in which case you now have just changed the pH and it probably doesn't work. And if you're just drinking straight apple cider vinegar, it's an acid going through your throat, it's going to burn. So I usually recommend the HCl. It's a fairly inexpensive supplement. The downside is most of them are not vegan. So there are some vegan supplements. I had a client who was not going to eat anything that was not vegan. And so we were able to find two. I'm still experimenting with them. But I will say that there are two herbs that can be helpful in a non-supplement way that can be helpful for, make sure I spell it right, meadowsweet, I think I spelled that right, Filipendia, and Fenugreek. And the meadowsweet, if you live up north, you can probably either grow it or you'll find it growing. It's both in Europe and here. Fenugreek, I've not had good success growing it. Ooh, I spelt that. Eek. I've not had success growing it, but I understand you can grow it here. It tastes like maple syrup, so value added. So that can be added into your digestive bitters or supplementation or used as a tea. Meadowsweet is actually the original aspirin. A lot of times people put the blame on that on white willow, and although white willow is where the commercialization came from, the initial alkaloid was taken from meadowsweet, and the Latin name is currently Filipendia, I believe. It used to be spirea, and they changed it a number of years ago for whatever reason. So I believe that the rumor has it, I have not researched it to death, but the name aspirin came from spirea, aspirea. And so somebody can check my history on that, my medical history. That said, we don't see the side effects that we see with aspirin, doing those, aspirin's really hard on the stomach, where meadowsweet is thought to be a trophorestorative, there's your word of the day, trophorestorative for the stomach specifically. So it seems to restore that lining and for appropriate secretions. Fenugreek is moistening and helps to soothe those inflamed tissues, and seems to also just make secretions easier for any number of different secreting cells. So we talk about it as a galactagogue, that it helps with breast milk, but it also helps with male semen, but it also seems to help with hydrochloric acid. The downside is those are slower, and if you're dealing with acid reflux or pain or malabsorption issues, you want it fixed yesterday, not a few months from now. So, and the other one is we feed it to horses. Oh my God, top shelf, starts with an A. Can't think of the name. Alfalfa, there we go. Alfalfa seems to have a role in that as well. But I would say the Metasweet and Fenugreek are better. So, that was a good rant. So, the short answer, as in with every symptom, because acid reflux is a symptom, is ascertaining why you got that. And the other one, forgot, there's so many aspects. Sorry, I'm trying to condense my 3-hour lecture into 15 minutes. A lot of times people get acid reflux when they lay down, and that can be a sign of the hiatal hernia, but it can also be a sign of low stomach acid. The valve that controls the top of the stomach, right? So, here's your stomach is right below your diaphragm there, and there's a sphincter, a valve, if you will, that is triggered by stomach acid. So if your stomach acid is high, your stomach acid is got a low enough number, i.e. you have high stomach acid, it will cause your sphincter to close. If you don't have enough, your sphincter stays open. So it stays open while you're receiving food, and then as the stomach acid starts to break that stuff down, creating the chyme where there's acid is a greater risk, it appropriately shuts down. If you don't have the stomach acid, you will get that increase in acid reflux with food in your belly or when you lay down. That can actually be a sign of very severe low stomach acid. So I always say there's not an easy test other than testing it with stomach acid or with hydrochloric acid. An endoscope does not tell you whether you have high or low stomach acid. It only tells you if you have inflammation. And both high and low stomach acid can cause inflammation. And not to be ignored, because right now, esophagitis, or you have inflammation somewhere on the esophagus or the larynx or wherever, that can lead to Barrett's esophagus, which can lead to esophageal cancer. Even though the risk is very low and it's a very loose correlation, I personally don't want it inflamed anything. It's unpleasant, it hurts, and it has the potential to cause other problems later on down the line. So my goal is always to say, how come? And then once you understand the how come, you do your very best to fix that stuff. Sorry, I'm reading as I babble here. Oh, the Metasweet, yeah. Yeah, I'm pretty sure, I know it used to be called Spirea, because when I first started in the realm, it was still called Spirea, and they were just switching it over to Filipendium. And so I've almost got it to the point where I can say its current name. All right, let's see Tammy had an interesting one, and there's so many directions that I can go with this one, and I'm not sure. I love getting the questions ahead of time because I can think about it a little bit. And this one I got almost an hour before we started, and I'm like, I don't know what I'm going to say about this. So she was looking for herbs, Western or Chinese, that were helpful for brain health. But she had a little bit of an explanation. I assume it was a friend or neighbor or family member. But they had gone in to get some dental work done, and started getting headaches, and the headaches got more severe and seemed to have led to a stroke. And it sounded like it was no stroke is minor, but some are less major than others. Let's just say that. No stroke is good. And there's so many different directions to go with this. So dental work, obviously, we see a correlation between oral health and specifically our heart health. and the dentists are quick to preach that from the rooftop. But there is a good correlation, whether we're looking at alternative medicine or Western medicine, that if we're seeing major teeth problems, there's oftentimes some major internal issues going on as well. And so it's always good to pay attention to dental hygiene. The downside is, and dentists, love them or hate them, dentistry hasn't changed a whole heck of a lot in the last 100 years or so. I mean, it might as well still be the barber / surgeon / dentist sitting outside the bar pulling teeth. And so, good dental work is expensive. And if you can't afford it, they just yank them bed daddies out and tell you to have a nice day. And when we look at some of the dental work, and it's usually things like implants or crowns or things like that, and sometimes just cavities that are not well investigated, that if they miss an infection that's going on in the roots or into the jaw, that can cause a range of serious issues, everything from just generalized inflammation of the head or face to autoimmune symptoms, to actual bone degeneration in the jaw, and a variety of allergies, sinusitis, changes in vision, all kinds of seemingly unrelated things. One of the questions I always ask my patients, if there's not a clear answer, it's like, okay, you're drinking a fifth of whiskey and you got elevated liver enzymes. There's no mystery there. If you broke your leg and you have leg pain, there's not a mystery. There's obvious things that are not going to require deep thinking. But when somebody all of a sudden is very healthy and then all of a sudden magically has bad headaches, chronic sinus issues, and they've never had that before, and I go through my usual questions, and I don't see an obvious answer, one of the things I'll do is ask about any dental work they've had in the year prior to the onset of symptoms, and sometimes it's that dramatic. And what I find that if they go, I just had this root canal done 3 months before this showed up, they'll go oftentimes back to that same dentist or another dentist, and they don't see anything. I oftentimes have to send them to somebody who specializes in, there's like functional medicine or alternative medicine dentists who do a little bit better job of imaging, where they're actually looking for that, where the regular dentists, unless they're exceptional, tend not to look that hard. They're not looking down into the jawline for little pockets of pus that are just going to show up as a shadow on the films. And it's one of those things, if you don't find the cause, if that is a cause, then it just gets worse and worse, and all of the usual things that we might do don't work. Like all of the usual headache herbs won't work if there's actually a impacted tooth there that's infected. So that can be a real trick, and you can sometimes get some hints at it, but usually it's just through good questioning. I learned an interesting thing today. I had one of my patients was allergic. It wasn't anaphylactic shock, but it might as well be. He had a very adverse reaction to epinephrine, and that's the adrenaline our kidneys put out, but it's the prescription type. So like you get stung by a bee and you have allergies to that, you get an EpiPen, epinephrine pen, and you stab it in your leg, and it saves your life till you can get to the hospital. So epinephrine's also used for a variety of other things. It quickens the heart rate and so forth. And so this guy said, well, I have a sensitivity to that. And he was like, I remember the last time I went to a dentist, I told him I'm allergic to, he can't use it. And I was like, I didn't know dentists used epinephrine. And he goes, oh yeah, whenever they shoot you with some Novocaine, they'll actually put a little epinephrine in there because it makes the medicine work faster and they can turn their chairs over faster. I don't know that that's why they do it, but that would be the logical reason. And I was horrified to learn that. You learn something new every day, and I always say, my patients teach me stuff all the time. So this was just last week, actually. And of course, the dentist ignored him and thought he was BSing, and used it anyway, and the guy promptly passed out. I always find it interesting. I think pretty much everybody has anxiety and palpitations going in to see the dentist. Nobody enjoys going to see the dentist. And so why they would put an injection, something into the injection that's going to cause anxiety and heart palpitations and racing heart, I just can't imagine. But, who am I to question traditional current medical practices? So I would say I would investigate that because you saw that correlation directly with the dental work. There's very likely that there's something there. Because, the act of pulling a tooth or getting a crown or a root canal doesn't necessarily imply that that's going to give you a stroke, unless there's some kind of hidden infection in there, in which case I would say it wouldn't surprise me at all. So if they haven't gone to investigate that, they may have poo-pooed you saying, ooh, there's something in the dental work. If they ignored that, I would make sure that whenever she's able to, that she gets that checked out a little bit more appropriately. One of the problems, if somebody's had a stroke, then it gets more challenging to give herbs. It doesn't mean we can't. We just have to be more careful because they're very likely on blood thinners. They may have been put on blood pressure medications and any number of other medications. So things like blood thinners are a narrow therapeutic margin. So when we talk about herb-drug interactions, things there, if you get too much or not enough, bad things happen. That's one of them. So it just means you have to be more careful. And usually start with subclinical dosages. You have to check their clotting time, their INR, and hopefully have a doctor that you can work with that allows you to slowly titrate or ramp up with the herbs that you think are appropriate. Ones that I generally consider safe are Gotu kola, Centella asiatica, and Bacopa. I'm just going to do that. And we're going to talk about Gotu kola some more here in a second, because one of my pet peeves came up on the list as well. Trying to not spend too much time on my soapbox. And Bacopa montanare, both of which actually grow here. Both of which grow here in Florida. Very easy to grow, very easy to find in the wild as well. I consider both of these, oh wow, that's amazing, Tammy. So that makes life easier. So those for sure. The Gotu kola in particular, I think of it as connective tissue anti-inflammatory. And it seems to have an affinity to the head, so that may help with any of that. The Bacopa, if there's any anxiety whatsoever or scatterbrained lack of focus, then the Bacopa is really helpful. It, besides an alertness, really helps with focus and, again, reduces the inflammation in the brain. I'm more hesitant, like everybody talks about ginkgo biloba. I don't use that. It is a blood thinner. And it is a Chinese herb, and we use it specifically for phlegm issues. And so unless that you see that energetic concept of phlegm, I don't recommend it. You can also look at things like rosemary, and although that has a platelet anticoagulating effect on platelets, it is a yummy spice, so that can be helpful. And if there is some damage, when we talk about strokes, It is a blood clot in the brain, and depending on whether it's in a tiny, not important part of the brain or big, scary clot in the brain, determines how bad the damage is. And so there isn't a ton of research, but when we look at lion's mane, the mushroom, and again, it's a vegetable, so I consider it very safe. The lion's mane is thought to regenerate some of the nerve tissue. So if there has been a loss of some function, even a little bit, that might be helpful as well. If there's any kind of motor loss of motor control, physical therapy, so I assume they would have recommended physical therapy for at least 6 months. I would say do it, take advantage of that. But also acupuncture can be really, really helpful in that first year post-stroke. I see less benefit later on. If it's been longer than that, not to say no benefit, it's still lots of benefit, but the biggest impact of the acupuncture is in that first year. And I would look for somebody who specializes in scalp acupuncture. It's a very specific technique that's used post-stroke. If there's any kind of pain or inflammation around where that dental work was done, until you figure it out, if there is a little pocket of yuckiness in there or something, I would also consider doing some local topical herbs. So you can literally dip the herbs and like a little pinch between your cheek and gum, like chewing tobacco. Super appropriate. And it can be any number of different herbs, but for local topical infection, I really like echinacea. It's one of the few things I use echinacea for. I really like plantain, not the banana, but plantago. And any plantago will do, so whatever your local species is. And you can mix or match other herbs just kind of depending on what's going on there. Anything from frankincense to calendula and so forth. If there are 0 medications, it might be appropriate to use St. John's wort internally. But I would say, like, with no medications, I won't use, if there's even over-the-counter, birth control, any medication, I won't use St. John's wort internally. But it is a great herb for inflamed nerve tissue, brain being a big old nerve, close enough. The other thing is oat straw, milky oats being the first choice, oat tops the second choice, or oak leaf, oat straw being the third choice, as just a way to help nourish and reduce the inflammation of the nervous system as a general whole. And the trigeminal neuralgia, so hopefully that works. Hopefully she's not getting any more headaches. It does resolve themselves in some form or fashion. And I would definitely chase after that dental work and make sure that there's not another hidden scary thing waiting there. And I want to say, just on the topic of stroke, stroke, we talk about it affecting the brain. And there's an acronym that is, this isn't very alternative medicine of me, but it's a nice little acronym that's helpful. FAST is face, arm, speech, and time. And so if you are having a stroke, it's usually an emergency. There's 2 types of stroke. There's hemorrhagic, in which case it doesn't matter, you're already dead before you figured it out. And the other one is ischemic, where there's a blood clot affecting the part of the brain, where you have a period of time where you can get help and prevent any major damage. So face droop, where you get one side of the face literally becomes lax and no longer has nerve function. Arm weakness, it may not be paralysis, it may just kind of not do what you wanted to do, and so you reach for the glass of water and you just bang your knuckles against the table and you keep trying and you're like, why isn't my arm doing what I'm telling you? And speech difficulty, you hear the words in your head but your mouth isn't doing what it wants. And then the T is time to call 911 if any of those things are happening. And there are things like Bell's palsy, which will cause the face droop, but it doesn't cause the arm pain. And it might cause some speech difficulty, but it doesn't usually affect the tongue the way a stroke will. So it might be a little difficult with Bell's palsy, but the safe thing is don't wait around. If you're getting those symptoms, immediately get to the hospital, call 911, whichever is most appropriate. And the general rule of thumb is take a blood thinner, i.e. aspirin. If you've got something like Cider, I've used that in the past for folks. Cayenne pepper, if you can deal. But that may give you extra time if there is a blood clot. And again, if it's hemorrhagic, it doesn't matter anyway. The opposite of that, so when we talk about a heart attack, it's usually instead of in the brain that we have some sort of a blockage in the heart or the blood vessels going into the heart. And this, again, shows up differently. And I always say, and I try to preach this one from the rooftop, it shows up differently for men and women. And so, some of you are old enough to remember Sanford and Son, where it's like, oh, it's the big one, and we think about the anvil on the chest and getting kicked by a mule, and, the gasp for breath, clutching the chest. And that's guys, because we're hysterical. So men tend to get more of the extreme pain, pressure kind of things, and women go, I'm a little fatigued, I'm sweating a little extra, I think I'm tired, I'll go lay down, and maybe there's a little neck pain or discomfort, a little jaw stiffness. And so for women, it is a silent killer. And even though we see people of color and men are more likely to die of heart disease, for women, it is one major cause of heart disease, or heart attacks, and death, because they don't recognize the signs, because they literally just get some, instead of sharp stabbing, shooting pains in the neck, shoulder, arms, jaw, back of the head, they get discomfort. They get short of breath, so they're just a little tired. They get a little nauseous, maybe they puke, but they figure they're just, something they ate. They sweat a little, and it's like if you're out gardening and digging a hole, you're supposed to be sweating, but like you're sitting there, doing nothing, and for some reason you're sweating. A little dizziness, fatigue, and we're looking for, that can happen to anybody, and so heart disease can be a hereditary kind of thing. So when we look at risk factors, it's one of the few things that men get, more often than women, but, that being male increases slightly your risk over females. Being not Caucasian, not white, increases your risk. And there's debate, is that a genetic thing, or is it a lack of access to health care for non-white people that they're not taken seriously? And there's lots of research to show that there is a silent, unintentional, but nonetheless bias towards non-white people in the medical system, so it's not recognized in the same way it's not recognized in women. Smoking increases your risk, high blood pressure, inactivity, obesity, diabetes, stress, and booze all can increase your risk factors of having a heart attack. So, if you have any or some of those, that you should kind of review those symptoms of heart attack and stroke, so that that doesn't happen, because that's sucky. All right, gotta check my list. Oh, I didn't do those. So I gotta do my, I'm a choreographer, I'm supposed to do my station identification here. So if you don't know it, I gotta do this so I can see what I'm doing, because I'm gonna flash weird things. So if you don't know it, I'm Bob Linde from the Tradition School of Herbal Studies in St. Petersburg, Florida. You can learn more about us at traditionsherbschool.com, or my clinical practice, where there's a number of great practitioners there, at acuherbals.com. if you're in the area, I don't know what the heck I'm saying. We have one of the largest herbal apothecaries in Florida. You can come by and say, hey, I need $1 worth of chamomile. We have Western and Chinese herbs, pretty much everything you want. We always forget to advertise or tell people, but there's a plant nursery in the back of the clinic. If you ever stop by, I encourage you to go and look because there's cool stuff back there. If you don't know it, not tomorrow, but next Saturday is an International Herb Day, and so please stop by and spend the day. Whatever. Herb Day is fun. It's free. Music, food. I make weird foods to feed people. Over 25 vendors. We usually expect about 1,000 people to wander through. Music and lectures. 2 lecture tents where there's lectures all day. We've also got both a Western and Chinese herbal programs here that are from beginner all the way through clinician, and we have 3 nights a week. We have intern clinic, where it's a reduced rate clinic that people can get access to awesome alternative care that me or one of the other practitioners is supervising. Monday nights, I supervise a bunch of acupuncture interns from East West College in Sarasota, and on Tuesday night is our Western herb clinic, and on Wednesday night is our Chinese herb student clinic. We also have open classes coming up in May. What day is it? Oh, on May 13th, that's right. Friday the 13th, I'm doing a free herb drug interaction class. We also have an Ayurvedic series that's, I think they're like $30 or something, that are broken down by body system, that you can jump in any time or take the whole series. Anatomy for the herbalist, we have Trisha who's teaching anatomy and physiology for the herbalist, for those of you who just think it's good to stay up on your general health issues and understanding your body better, and really encourage it for anybody who's taking any of the herbal programs here, because most of us didn't take enough science classes, and it was so long ago we don't remember anything. And then Ruthie teaches the ever so awesome medicine making circle, and she picks an herb to talk it to death for 2.5 hours, make medicine, growing, harvesting, folklore and medicinal uses of each herb. And to be able to spend that long time talking about a single herb is absolutely amazing. So I'm super jealous of that. And here, I'll do selfless promotion. There's all the cool stuff. Services, herb consults. I think we have 4 acupuncture physicians, herbalists, all kinds of other cool stuff. And if you feel like going out to Colorado this summer, July 28th through the 31st, Durango, Colorado, the Good Medicine Confluence. You can find out more information at planthealer.org. I'm going to be lecturing, so I'm super excited. I've never been to this one before, and I've heard it's absolutely awesome and very different from some of the many other herb conferences out there. So I'm excited to be there, and you can get either tickets there from the organization, or you can make sure nothing's vitally important here. Nope. Or you can get tickets from me as soon as I figure out how to do that, because that's how they pay us, is they give us a bunch of tickets so that we can sell them to people. And I know we've got a couple people from the area heading out there, and for some of you further afield who want to go have some fun in Durango, I hear it's an awesome town, you can join me out there. I think I'm teaching like 5 or 6 classes. It's completely insane. So, let me jump up on my soapbox here. I think that's all the ranting I'm going to do for a moment. So, she got a plant that was, I'm going to pronounce it wrong, I always do, Hydrocolon asiatica. And I did the same thing you did. I Googled it. And it drove me completely insane, because all it did was pull up Centella asiatica, and I chased that down for a good 45 minutes trying to figure out the difference. So I don't have a good answer for you. The problem is dollarweed and Gotu kola. There is so much confusion over those 2 plants that if you search for one, you're going to see pictures of both, and they do not have the same action. They're not in the same plant family. So like when we look family, genus, species. They're not in the same family. The dollarweed, pennywort, hydrocolon, spa, and there are many species, is in the Araliaceae family, where the Gotu kola, Centella spa, Asiatica being the herb of commerce, is in the Apiaceae family, which is the same as celery and parsley. So my short answer is they're not the same. I would say look up Centella asiatica, and where the stem attaches to the leaf will determine whether it's a centella. If the stem attaches, like, so the pennywort is here, has a, although it's got indentions, it's roundish and the stem attaches at the center. That is a pennywort hydrocolon. If there is a shovel shaped with a cut in and the stem attaches at the cut in, then it is a centella. Centella asiatica or the Florida species are used interchangeably. Those are specific for helping with reducing brain inflammation, connective tissue issues, helping with memory, and is a phenomenal herb that can be used as a food. The dollarweed / pennywort hydrocolon is used more for liver and gallbladder and topical medicine, and will cause stomach upset if you eat too much of it. Now, to just really confuse the living crap out of you, both are used in Chinese and Ayurvedic medicine, and both are called Brahmi, as are many herbs that are really good. I use the heck out of Gotu kola. I just think everybody needs some. I will snack on that darn near every day. You can make soup out of it, and I frequently add that into my patients' formulas. Whereas the pennywort, I learned that primarily as a something to use for the gallbladder, that its bitter flavor will cause the gallbladder to spasm. So for a sluggish digestion, it's a digestive bitter, and to prevent gallstones, that was a nice addition. Especially for the pennywort, always use a caution if you're harvesting it yourself, because it grows in wet, swampy areas, and so should always be heated in some point to kill things like bacteria and amoebas and all kinds of other fun stuff. And it is the pennywort is cold in its nature and can cause stomach upset. So for somebody who has cold digestion like me, think low stomach acid, it can cause bloating, nausea, diarrhea, fun stuff. So it drives me nuts that there is, send a picture for sure. I'll be able to tell within 2 seconds. I won't check it necessarily while we're online, but maybe I'll try to post it in the, it'll show up in the comments for everybody to see afterwards. And I did see a comment, I hate to say it, Wikipedia. It did see a comment that the one that was Asiatica, the hydrocolon Asiatica, is now called Centella asiatica, and so they didn't have a picture specifically, so it drove me nuts. So what they sold you, maybe it's Gotu kola, maybe it's not. I will also say I find Gotu kola actually tastes okay, kind of celery-like, where the pennywort is very bitter to me, bitter and acrid, and I don't enjoy snacking on that. So looks absolutely nothing like dollarweed. Okay, good. So you may actually have a good plant, Centella, in which case, good. It's a great plant. Everybody should grow it. Super easy to grow. All right, I got 30 minutes left. Let me see what I got left. All right, I did all of those. Let's see. Oh, I'm going to save that one for last. Trigeminal neuralgia. So, trigeminal neuralgia is a pain, literally. So this is a type of nerve pain. It's thought that it may be autoimmune or it may be structural. They're still trying to figure that out. And literally, it's a nerve pain that kind of emanates from around the ear and then branches out, the trigeminal nerve, one of our many facial nerves, and is debilitating to the point where people, anything from severing the nerve, which has its own issues, to it is a cause for drug addiction, alcoholism, and suicide, that the pain is so severe. So Trigem is nothing to sneeze at. This is a serious problem and usually can be addressed successfully, sometimes with herbs, sometimes with other means. I would say cutting nerves is always a last resort. I don't recommend it. Steroid injections have been used sometimes. Sometimes they work, sometimes they don't. And I would say temporary use of things like steroids is fine, but it's not a long-term solution. Steroids aren't fixing stuff. So I'm a fan of fixing stuff or taking things that have less severe consequences from their long-term use. Steroids, like, if you did that once a year, who cares? If you did that every other month, it's going to start to have some real downsides to it. So, usually there are food triggers or stress triggers for the trigeminal neuralgia, and so ascertaining those is important. And would point more towards an autoimmune type of issue. I've seen it also related to structural issues when they have a misalignment of the jaw and so forth. So when there is a structural issue that's triggering the trigeminal neuralgia, I usually look for things that are more structurally related, either chiropractic care, craniosacral work can be very effective for that. So some chiropractors know how to do that. Some massage therapists know how to do it. Occasionally you'll find an acupuncturist who knows how to do it. Sometimes mouth guards or mouth braces can be used to help to realign the jaw. But more often than not, it's not that simple. So it's usually the stress or the food. If it's a food, there's usually a food sensitivity that can be explored and addressed. And if it's stress, then it can be better addressed with herbs. And I'm going to say herbs and acupuncture. I've actually had really good success with acupuncture with trigeminal neuralgia. I had a guy, it was sweet actually. He came in and you could tell he was having a flare-up. And he had scheduled an appointment. I think he got in like last minute. I had a cancellation. He just like happened to jump in. And light sensitivity, the trigeminal, he was a big burly dude. You could tell he was literally on the verge of tears. He didn't want to do the medications for it because he wasn't able to work if he took the medication, or if he didn't take the medication, he was in a flare-up. And so I was like, sometimes I have success with this, sometimes I don't. And I was like, have a seat. And I didn't even go through my usual questioning, because when somebody is in an acute flare-up of pain, you don't necessarily go for the root problem. You go, all right, I need to give this person relief, and that's symptom suppression. And ideally, that leads to, then once you get things back in remission, then you can go work on the root issues. So a lot of times I do channel palpation, or I'll just squeeze, and so there's a point. See, I gotta do my little manipulation here. So 4 fingers up from the back of the lateral side of the arm, from the wrist crease, in between the radius and the ulna, is a point called Sanjiao. There's actually 2 points there. Sanjiao 5 and 6, and I pressed on those, and he had a noticeable, probably 25% reduction in the pain just from me pressing on it. And so usually if I can get a change in the symptoms at all, any kind of change, just from pressing on an acupuncture point, acupuncture becomes a really powerful tool when I'm trying to reduce, to just give them relief. I was able to do acupuncture. He couldn't lay down. That actually aggravated. So I just had him sit in a chair, hit a few points, and he was ecstatic when he walked out that it was that easy for me to knock that back. Other points that I use, I used Stomach 44, Liver 3, and LI, large intestine 4. I may have used some other ones, but those were my biggies: the Sanjiao, stomach, liver, and large intestine. And if you're not an acupuncturist, because most of you on here are herbalists, you can stimulate those points with a magnet, a tuning fork, a diluted essential oil, a crystal, mash on it with any old thing, put a poultice on of the herbs. The limit is your creativity. And so the more effectively, the better you access those points, the more specific, the greater the relief that you'll get. Sometimes you'll get more relief from one side or the other, and so I find it's helpful to go around and press those points and on both sides, they're all bilateral, and to see what has the best success. You read a lot of times about cayenne pepper being used. I don't use cayenne pepper for Trigen. Cayenne pepper capsaicin is a counter irritant. It's like if you put a hot poker on your nerve would be so horrified it would shut down. And so when you do that, it's like putting fire on a nerve, and so the nerve literally stops. So it's an overstimulation of the nerves. It's temporary, so it's okay. Sorry, that's my phone. Somebody's yelling at me. Hopefully it's not anything embarrassing like I have boogers coming out of my nose, because I'm not going to read it right now. So I tend to use St. John's wort oil, an infused oil of St. John's wort flowers. It should be a red oil, and I'll use that topically both when they're in flare-up and especially when they're not, to try to reduce the inflammation to that area, to that nerve. And if you go and read and explore about all the passageways of that, I would hit all aspects of that nerve as well as the cervical vertebrae that branches off of. If they're on zero medications, including over-the-counter, I would use the St. John's wort internally. You can use that as a tea. Sorry, strange sounds coming from the other room. Milky oats internally would be a great choice. Magnesium can be helpful internally. I would say looking to the pattern, and I would look to the Gotu kola and the Bacopa both. But this is definitely a time that if you have access to an acupuncture physician, I would highly recommend an acupuncture physician. Unless it's structural, in which case the acupuncture might be helpful, but then massage therapy, chiropractic, and some sort of a brace, all can be super helpful. Ear seeds, if you've learned auricular therapy or ear seeds, and that can be done by herbalists, all of our herbalists learn that awesome technique. You have to do it in the opposite side of the pain. Sometimes it works, sometimes it doesn't. It tends to help more with the prevention by keeping the stress levels down, but it may not have the effect on the acute flare-ups of the pain. Those are my biggies, and I will say, I know that sounds like an oversimplification, but those tend to work. I find that you can get fancier. There's definitely different techniques. There are Chinese formulas for head pain, Tong Chiao, I forget the rest of Zuyu Tong, something like that. But I find those are actually too aggressive. So I tend not to do those. Sorry, I'm totally cheating. She sent me the Gotu. Yeah, well, that's totally Gotu Cola. So, oh wait, I'm going to make it see. Everybody can see what Gotu Cola looks like. Oops, wrong way. Let's see if this works. Those are Gotu kola, and you can see the cut there, the kind of shovel head, and that stem connects right at the cut in there. And so that is 100% Gotu kola, no questions asked. So eat the heck out of that, make some Gotu kola soup. So yeah, Trigem is a process, but you can have good success with it without a doubt. And so with it, you have to look at both, what do I do for acute flare-ups? What do I do to manage the triggers for flare-ups? And then third, you have to look at, how do I correct the underlying issue? And that's about balancing the system out. I would argue either structurally or energetically. Kratom, my favorite subject, or not. So the question was, how do I use Kratom? Well, I don't know. I'm drinking it. There's actually mostly iced tea in there, but some Kratom left over. So Kratom Microbgyna speciosa, I think I just pronounced that wrong, but that's okay. And there's so many things I can say about Kratom. I'll probably take the rest of the time on it, unless anybody else has, earth-shattering questions, because I do like to talk about Kratom. I think I actually got everybody's questions. I may have. I'm looking at my notes here. I don't think I missed anybody, which is cool. Usually I'm leaving somebody in the dirt. So Kratom, and both ways are pronounced, are correct pronunciations. I've had a few comments about that, and I found reference to say, no, it's both. Kratom, you name it, it's correct. So you say potato, I'll say potato. Okay, I say potato too, but whatever. So there is a growing body of information about Kratom, and it is a phenomenal herb, and it is an herb. It is not a drug, although it can have drug-like properties to it, especially when the chemicals in it are isolated or concentrated. It has some ability to cause addiction, probably about a 10% rate of addiction. And it's usually in people who get addicted to pretty much anything they do. It's an interesting one. So it is not an opiate, but it does fill the opiate receptor sites. And so does chocolate, by the way, cacao. So if you are struggling with legal or illegal opiate addiction, Kratom is a very effective way to withdraw off of that without too much trouble. The chances are decent that you'll get, it's a 10% chance that you'll get addicted then to Kratom. I'm going to say I'd rather you were addicted to Kratom than you were to heroin or methadone or any number of other drugs that are legal or illegal. Especially, it's socially acceptable somewhat to use the Kratom. It does not cause the same level of physical damage to the body. It doesn't cause as much inebriation, and it allows you to function. Probably the two things that, or three things that Kratom is used most for: to get off of opiate drugs, which is super important. For anxiety/focus, that's what I tend to really like it for, anxiety and focus, and particularly the focus of, and I'll throw in there, I guess, 5 things. Energy. I really like the energy aspect of it. It's a kinder energy than coffee, and also kinder to the stomach, but there's some variant in there, and I'll talk about that in a second. But I think the thing that it's used the most for is for pain. And it is an effective painkiller in the same way that probably better than opiate drugs, honestly, because from what I hear from people who are using opiates for pain, it's not that they kill the pain so much as they just don't care anymore, especially when we look at chronic pain. Short term, it seems to have some benefits, but long term, it's not that great for pain. So the Kratom does a better job for pain management. And has milder side effects than the opiate drugs. And so we already said 10% of the people will get addicted, so they need to be careful with that and stop periodically to ensure that there isn't some dependence is probably a better word for it. There is some level of self-regulating with it, i.e. if you drink it too fast or take too much, you're very likely to get nauseous and or puke. That's usually the worst symptoms that people get. They will say, oh, I went to the Cabo bar or the Kratom bar and I got one and they didn't have any food in their belly and they were like, oh, that tastes bad, and so they throw it back really fast and then they have to go sit down. I've actually had people pass out from doing that. So it's not a fun thing. So I always encourage people to sip it. And especially the first few times you do it, make sure that you have food in your belly. As a general rule, and so as with all plant medicine, there is varying degrees of quality out there. There's total crap stuff out there that is basically useless. And there's really good quality stuff out there that's been tested and properly stored and so forth. And there's not an easy way to tell until you get some experience with it, and that's true of any plant. Because it doesn't have a lot of volatile oils, you can't just smell it and figure out whether or not it's a good quality or not. So taste is somewhat of a tell on it. It should be very bitter, a little acrid, actually a lot acrid now that I think about it. There shouldn't be an oily sheen if you put it in water. It does not have a lot of oils in it, so you don't get this oil slick. Like if you take if you put black tea and you put it in hot water and leave it for a couple of hours, you're going to literally see an oil slick on there because there's some oils in there. Very little in kratom. One of the downsides with kratom is that a lot of people know way more than I do about kratom probably. But that's the only plant they know, so they don't know anything about plant medicine. They just know this one plant. And when kratom came to the U.S., it was brought primarily as a powdered herb rather than a whole leaf or cut and sifted. And nothing wrong with powders. They're very convenient to work with. The downside is they have a lousy shelf life. So the more we chop up any plant, the more we chop up any plant, the more it will oxidize and start to break down. So it won't last as long from the moment it's ground to a powder until whenever you utilize that. The more it's exposed to light, the more it's exposed to heat or to air, it will quickly lose its benefits. So it unfortunately, for a while I carried cut leaf and I literally couldn't sell it. Everybody would look at me like, what am I supposed to do with this? And I was like, make tea out of it, the same you do with the powder. And they just looked at me like I had three heads. Even though they could use less, more cost effective, better outcomes, it didn't matter. They wanted powdered herbs, so I literally only carry the powder now because of that, as do most places. Don't bother with the leaf. So I will continue to tilt at that windmill and try to educate people about the less processed your plant, the less likely it is to be adulterated, because you can hide anything in that powder. You could put long clippings. If you dry it and powder it, it could be long clippings mixed with some kratom. That's not common, but if you have whole leaf, you know exactly what you're getting. There's no question in your mind whatsoever. And it's funny, I have a number of kratom trees that I have growing, including one that's like almost 20, 30 feet tall. And if I get a leaf off of that tree, I can literally peel off about an inch or two, chew it for about a minute, and then I have to take it out of my mouth because the effects are so strong. That's what fresh kratom does. That it's focused, it's odd. It's focused relaxation and complete pain relief, and almost a little loopy if I do the fresh like that. That passes quickly, and I'll literally roll it up in the fresh leaf and put it in my pocket for later. And so I never get that effect when I use the dried powders, no matter where I buy it from and so forth. So it is an interesting thing. I generally encourage people to start at about 3 grams per cup of water, hot water. Oops, and that was weird. I think we just had a power surge. That was super exciting. And so 3 grams in a cup of hot water. And it is helpful to add an acid into the mix. So some people will use orange juice, lemon, lime juice. Everybody has different effects from it. I personally like apple cider vinegar. I happen to like the sour that's apple cider vinegar, so that's me being weird. So the way I tend to make it is I use probably for myself, I use about 5 grams of kratom in I probably put it in more than a cup of water, but I'll add the kratom, I add some of the apple cider vinegar and make kind of a mush slurry. I'll boil water, pour that on my kratom, stir it up and mix well and let it sit on the counter for whatever amount of time I have. If I make it at night, the night before, I'll put it in the fridge. And that tends to do a very good job. There's lots of other things the word of the year is potentiator, and everybody has the secret master blah 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 blah, and everything from ashwagandha to black pepper to I don't even know what else. I have not seen there's some research to show that the black pepper is a potentiator. Everybody got that from turmeric, although I see the same thing about turmeric as a potentiator. The alkaloids that seem to be most active in it are acid soluble, so anything that's an acid will be effective. So you can use citric acid, vitamin C, or fruit juices, citrus juices, acetic acid, my apple cider vinegar. A lot of the research was done with a different acid, which I totally don't remember at the moment. I don't recommend extracts or concentrates of it. I tend to see the biggest issues with that, and I see a larger amount of people who have dependence on it if they start doing extracts. I generally don't like the pills either. There seems to be, and quality control is improving exponentially, but I see more adulteration and issues with pills than I do with the powder itself. And so I would say, this is true of every herb, know your suppliers, and trust and verify. So like we send our kratom, the people it's tested in Indonesia, which is BS. That's meaningless. They can pay for that without actually getting it tested, and they don't do extensive testing. The people we buy it from do batch testing, and we do batch testing on top of that because I don't trust anybody. And so that's always good to do with your herbal medicine, just to periodically do that. It's expensive to test for heavy metals and pesticides, but to still do that periodically is important. And for things like mold, mildew, yeast, those are fairly inexpensive. I think it's under $50 to test for that. Heavy metals is more like $200 or $300. So, you look for your higher risk things and check a distributor periodically, assuming that they're getting it from the same location. In general, when we look at kratom, the whites are more stimulating. The greens are very middle of the road and a good starting point. The reds are more relaxing. So for anxiety, the reds are better, and the reds seem to be better for pain and are better for nighttime, that reds don't keep people up. I really like the whites because they're more stimulating, and I like it as a stimulant. And so that's primarily what I do. I'll tolerate a green if I'm out of white, because I still get the focus, but I don't get quite the energy level that I get from the other herbs. here in Tampa Bay, St. Pete in particular, we have the largest collection of kava/kratom bars of anywhere else, and there's more opening, and they all seem to be doing fine, which is amazing. And I would say, is herbs go, it's one of the more controversial but fastest growing herbs to be used, because we have an opiate epidemic, and it continues to be an epidemic. So I actually encourage the use of kratom, both to get off of opiates as well as instead of opiates. The other issue, I just had a brain cramp. The other issue is that it is a much maligned, it is probably more maligned at this point than cannabis. That some of the same ridiculous languaging and inappropriate languaging is being used with kratom as was with cannabis back in the day. And it is banned in Sarasota County. There's been an attempt at least once a year by one of the, I think she's from West Palm Beach. There's a woman who's a legislator who tries to get it banned in the state at least once a year. There's a couple of states and a couple of cities where it is banned, and so we are constantly, as are all of our herbs, are under attack to lose access to them. And one of the things that is often touted by the FDA and everything else, the USDA, FDA, you name it, they're all saying it. It's like, for safety, they're trying to protect us, and I appreciate that. But the reality is, I can go to Home Depot and buy Angel's Trumpet and Oleander, two deadly plants, both of which kill people regularly. I believe all of the deaths that are associated with kratom have been shown to not be related to kratom. They're either a chemical extraction, compare opium flower to heroin. There's a big difference. So when they extract a chemical, there's been issues, or that there were multiple other deadly, life-threatening prescription medications that were legal and illegal in all of the people who passed away. And so it's unfortunate. And it is the woman and the legislator in West Palm Beach, unfortunately, her child or teenager passed away, and he had been addicted to drugs and struggled with mental health issues, used kratom to get off of the medications, and then fell off the wagon. And I don't remember whether it was an overdose or suicide, but in any way you slice it, it is a horrible, tragic thing. But unfortunately, kratom ended up being blamed as opposed to some of the other issues that were going on. There's the American Kratom Association is a great resource to learn more about some of the political aspects of kratom, as well as safety, usage, and so forth. And I think there are many herbs that can be used or abused, and this is one of them, without a doubt. And it doesn't mean that we should restrict its use necessarily. It means we should educate and use it with caution. And so in the same way, Tylenol is a really effective over-the-counter, and it should be used with great caution because long-term use, it causes liver damage. It should never be used with alcohol. Horrible consequences if you take it with alcohol. Overdosing on it is one of the leading causes of liver failure and hospitalizations. It's from Tylenol, literally over-the-counter, that you can buy massive amounts of it. So the reality is, if there is a safety issue with it, which there really isn't, then we should be educating people. And if we are concerned with safety, I would say that there is, obviously a lack of information or research that is backing that up. And it has been shown to have numerous medical purposes, uniquely so, that would qualify it never to be banned. And unfortunately, that does not seem to be, sorry, I'm climbing up on my political soapbox, that does not seem to be a proper criteria when we look at banning herbs. Cannabis, of course, was banned, and despite the volumes of repeated benefits of cannabis, it continues to be banned. And so by every criteria of the federal government as well as state governments and their medical oversight, there should not be any plants that are banned, and yet they continue to keep it as a federal illegal plant, and they are trying in the same ways and with all the same flaws, they're trying to ban kratom. So I hope you pay attention to that. Donate to the American Kratom Association. They didn't pay me to say that. And I would say use it with caution. And if you're going to use it, take breaks, and always take it with food, and start with the lowest possible dosage. And know that kratom doesn't fix chronic pain. It is a pain reliever, and so you can use kratom for managing pain whilst we try to fix the underlying issue. And we don't oftentimes think of herbs as fixing pain, but when we use energetic approaches, and Chinese system does a great job at fixing pain with herbs, and Western herbal medicine does. It's just you got to be a little bit more creative. So it's one of those things to always educate, check multiple sources, make sure you're getting quality herbs from a quality supplier. Yes, I sell kratom too. But also make sure that we're constantly, that we are the watchdogs of the local, state, and federal governments, so that we can ensure our access to all of our plant medicine all of the time. And it is important that, we see states, I believe it's Alabama, Damiana and mugwort are illegal in those states. That's a crime, and cannot be justified by any amount of research. So this is something that's not unique to our modern history. This has gone on forever. The removal of mugwort out of the manufacturing of beer, and the substitution of hops for that to sedate the masses. And I'll save that for next month. It's an interesting history of beer. It is a wonderful plant. It can be grown here in Florida. And there's much to be learned, and we continue to learn more about it as the research is being done and more experience is happening with it. And just make sure you got good quality. I actually, Miranda, I'm with you on that. I wish that they just sold the old 70s weed. And didn't, more THC does not make better. And you're right. Maybe we'll talk about that next month. I'll get on a good rant about the pros and cons of cannabis. I keep threatening to teach another class. I taught that at an acupuncture conference. The formulating and medicinal use of cannabis is, I think, something that we all skip. That it's the only herb we use as a single. And we should be using it in formulation the way we do with all of the other herbs when we're trying to take care of serious medical or energetic issues. Yeah, without a doubt. All right, so it is about that time. So if you missed it before, I will give myself this plug. I'm Bob Linde from the School of Herbal Studies. We teach Western and Chinese herbal medicine. You can learn more at traditionsherbschool.com, or the clinical practice or student clinic at acuherbals.com. We're here in sunny St. Petersburg, Florida. Please move down and take our program. Come join us for Herb Day if you're anywhere within the Tampa Bay area, or want to drive or fly even further to come to our awesome Herb Day next Saturday. And you can find this and all of the other ones we've done in the past, and lots of other cool recordings I've done on the School of Herbal Studies YouTube page. Please subscribe, because one of these days I'm going to start doing it at least once a week. I have been a little overwhelmed with lots of extra stuff, getting ready for Herb Day. So hopefully I'll get back on getting those launched every week, so that you got lots of little cool snippets of me talking about herby things and doing herb walks and so forth. And I hope I see lots of you online or in person at the Herb Drug Interaction class or at Herb Day. And if you're all lucky, I'm going to do I'll do a little live recording from Herb Day in the middle of the madness. So you all have a wonderful evening, and I hope I see you all soon. Keep playing with those herbs and sending me those questions so I can hurt my brain some more. Bye. Good night, all. All right, how do I turn this thing off? There it is.